Hi friends, welcome back to my another video. In today's video, we are going to learn a new topic about the culture, cultural competence. Now, what is a cultural competence? It is an in understanding, respect between the patient, effectively interacting with the patient, and diverse cultural backgrounds, especially in fields like healthcare. So basically, uh, cultural competence it's this. Before getting started, I have to say you that in from the past 1 week we have not making any video, and this is our today first video after the 1 week, because I was studying and busy with my personal homeworks, and today I have got time for making the video. So now from today we are going to start our syllabus. Going with the syllabus, we are going to start with the syllabus and do with the syllabus. So now, before getting started, I have to revise the old topics which we have taught in our previous videos and previous scripts. So firstly, we have started the neurological disorders. In the neurological disorders, and in neurological disorders we have learned about so many topics, and we have learned about our body nervous systems like central nervous system and primary nervous system. So this both nervous system in these both nervous systems we have learned the diseases of them and the infections of them, how to find out them and what are the symptoms of them, how to get how to get cure of them. So we have learned some diseases. I will tell you about this all, like magnetis, Alzheimer disease, multiple sclerosis, and what is there, so many topic we have learned in our neurological disorders. Now in Medicapedia we have started the nursing concepts, and now we have in nursing competence, means cultural competence of the nurses and doctors, which uh, which are the and attitude and manners which the doctor has in cultural competence. In before that we have learned about the nursing concepts, and before that we have learned nursing ethics, nursing and we have learned about the nursing healthcare system, nursing sequential steps, and delivery system of the nurses. We have learned this much things in our previous classes of the Medicapedia. So fully we have started and we have learned so many topics in our Medicapedia also. Now, what is the cultural competence in our Medicapedia? Firstly, cultural competence is competence is the thing which involves respecting, understanding, effectively interactions with the patient, and diverse about them, backgrounds of them, especially the things like in fields like healthcare, which we has the core definition, means the healthcare providers which adapts the care to the patients, means they gives an care which the patient has needed. They doesn't get stuck at all, means they first know the patient, what the patient has, how the patient is, and what comfort patient likes, means how what manners, what talking manners the patient likes. They knows that first, and after knowing that they will interact them and they will respect in that way, and they give best effectively interactive care to the patients, and they needs they reduce the disparities, and they improve the outcomes of the regardless ethnicity or languages. This goes beyond awareness and to include the self-reflection on basis the tailoring services like language support, traditional practices, like they will talk in the fluent language and the sweet way of the language the patient likes to talk, and they adapts and care adapts the care of that patient, and they gives their care to till the patient doesn't get cured and the patient doesn't get recovered, and the values beliefs, and they also doesn't make any um, this misunderstanding between the religions and backgrounds, and the personality. They give the respect and understands, and they give an effectively training and interactive care to the patients. Now, what is the key components of them? Means basically the nurses are awareness of one's own cultural basis, and they knows the knowledge of the diverses and the diverse of the health, and they beliefs on the practices. Means they also own the one culture, means awareness of the one own culture basis, means the cultural of the patient, the culture which the patient had, the care which the patient want, they knows all of them and give the best care. Now, knowledge of the diverse health beliefs and the practices are the patient which has from their own and they used to do, and they gives the health beliefs to them, and the patient which had in the home the care, and uh, how many from months the patient was struggling with that disease, and they knows that how what small treatment the patient takes in their home, they knows all of them. Now, skill for cross cultural communication, like desiring to engage empathically, and they be so empathetic with them, and they think more about the kid, and they ongoing they also encounters the with the varied patients, means they also give the varied and verified care to the patients. Now, I hope you understand what is the cultural competence, and how does the cultural competence works, and how many cultural competence rules are there, and key concepts are there, and the core definition of the cultural competence, what is that. So I hope you understand. Thanks for watching my video. Bye bye.